Hello, welcome back to the manual for the operation of the painted study part 2. Here we will show you how to upload the data from your completed pandemic influenza forms onto the painted prospect database. As noted in part 1, in the event of an influenza pandemic, you will have been contacted by the research team here at the University of Sheffield and provided with a username and password for Prospect. So let's look at how you upload the data. As the study is activated and clinicians start to use the pandemic influenza forms, you'll be ready to upload the data. So please access the Prospect database at the website address shown here. We can show you how to upload the data. I'm going to go ahead and log into the Prospect database and show you how to create a painted case. So when you log in, you'll find your site listed here, denominated by 2-3 letters of your trust name, and in order to create a painted case you must have the NHS number shown here on the pandemic influenza form. So I'm going to go ahead and create this case with 6 as the final digit, as I've previously used 9 in another example. So that will create you a form which resembles the pandemic influenza form, and all that we require you to do is to transcribe the data as seen on the pandemic influenza form. So I'm going to go ahead and show you how to transcribe the data from the pandemic influenza form into Prospect. Attendance date of the 12th of last year. And all we needed to do is press the calculate age button. The university don't have access to the dates of birth. Now here we can see whether the patient has been withdrawn. Either the patient has given a verbal instruction that they do not wish their data to be used within the painted study, or they've been given a leaflet and have indicated with the tear off slip from the leaflet that they do not wish to participate, in which case please tick either of these boxes, which will end the form there. Click save, and that's all that will be saved from that particular individual. Otherwise, please go ahead and enter all of the presenting features and the rest of the data as shown. I'm just going to show you an example rather than type it all. They've been referred by themselves. They have had a previous vaccine, but no antibiotic therapy for this illness. The symptoms have persisted for 3 days. Current medication, they're taking inhalers. They are allergic to penicillin, with a past medical history of severe wheeze episodes. They've not indicated any social isolation, and performance status of limited strenuous activity, can do light. And chronic disease indicated here as asthma. For paediatric cases only, to enter data here, if indicated by a tick here. Are they obese or pregnant? No tick obviously indicates no. With a likely diagnosis of viral illness, influenza, pandemic or seasonal. It is important that these numbers here are transcribed accurately. So I'm just going to keep entering them here. Normal 456. Alert with an abnormal chest x-ray and a normal ECG. The clinician has indicated severe respiratory distress here, and that bloods have been taken. So when you click that box, it opens up the bloods investigations. Again, please transcribe these as accurately as you can. Again, I'm not going to complete them all. They haven't indicated any oseltamivir or antibiotics, So you can leave that blank, but enter the comments as written, and this patient is going to majors for nebulizers. So now you've entered all of the data onto your prospect form, you can click save and that will create your first painted case. So please go to the manual for the operation of the painted study part 3 for how you can complete the follow-up form.